Good afternoon, everyone, and a very warm welcome to this, the final webinar in Public Health England's Prevention Concord Act for Better Mental Health Learning Event Series. My name is Anna Howells, and I'm joined today by...
My name's Lily McCura, National Lead for Public Mental Health at Public Health England.
Thank you, Lily. And also joining us today, we have Corinne Harvey, Public Health Consultant in Yorkshire and Humber. And also on the line, but you can't see on your screens, is Andy Bell from the Centre for Mental Health, and we'll be hearing from both of those later. A quick note on who's supporting this event series. So I work for Kaleidoscope, which is a social enterprise set up to improve health and care. And ourselves and the King's Fund and the Centre for Mental Health have been supporting Public Health England to roll out this event series. So again, thank you so much for joining today. We would very much welcome your comments, your questions and your reflections during the discussion. There's 3 ways that you can join the conversation. You can either use the Ask Question feature on your screens in front of you. You can join the conversation on Twitter using hashtag Prevention Concordat, so very catchy hashtag we have there, or you can email us hello@kaleidoscope.healthcare. So please do send through those questions or comments anytime. But to kick us off, we're going to turn to Lily to talk a little bit more about the Prevention Concordat and what that is. Lily, over to you.
So, as most people know, is that last September we launched the Prevention Concordat as a way of galvanising action to get every area in England to focus much more on the prevention of mental health problems and the promotion of good mental health. And so we thought back then, looking at what the evidence of what people were already doing and what could be built on, and what we knew worked in terms of the different interventions and approaches that could be used, that actually that cross-sector action was the way forward. And so with the Concordat, we brought together a number of key people and organisations that could all help support local areas to do more on those 2 things. So what we've been doing over the last 6 months, through the events, through developing additional ways of supporting local areas, we've been looking at how can we help every area to access and use the best available data to plan and commission the best mix of provision that meets their local needs, and also at the same time reducing health inequalities across mental health. One of the things I think that we've found in the last 6 months in particular, and it came through very clearly through the events, was actually that it really is that the times are right for this type of work. Whether that's in the NHS, whether it's in local government, whether it's in private and other parts of the voluntary or public sector, again, there's a role that everyone can play. And again, through the course of this webinar today, we'll be touching on a little bit of those examples, and also I'll be flagging up some examples of some of the signatories that we've gained over the last 3 to 6 months.
Brilliant, thank you, Lily. And would you just like to touch on where you've been over the past few months and who's been involved?
Yes. So very much guided by quite a strong appetite, we decided that really the fairest and most effective way would be to do a tour of England, giving everybody a chance to actually get a bit more familiar with what the Prevention Concordat is about and how they can get involved, whatever their role is. So we started off in Durham, and then, well, actually we started in Bristol, tell a lie. So we started in Bristol, moved over to Durham, and then sort of navigated ourselves around the country, making sure we covered Yorkshire and Humber, South West region, the Midlands, as well as in east of England, and of course London as well, both as an opportunity to allow people from London to attend, but also so it's a chance for people to interconnect from those areas around. We added on an additional session, which was in Cambridge, again, to look at the particular needs there. And one of the things that came up strongly through all of the events was something about making sure that, in the way that we approach the Prevention Concordat, we make sure that we serve the needs of those who are in cities as well as those in more rural areas. And I think that, again, that sort of urban-rural lessons learned is a really important one that we need to be bringing in much more strongly into not just the work on mental health, but also more generally. And again, that's something that we all see reflected in how we go forward.
And then finally, just touching on the digital events that we've been running.
So I think, again, one of the big successes, I think, actually has been this chance to have these webinars. I mean, both as a chance to connect with people, have conversations wherever people are at, whether that's geographically around the country, or just wherever they're physically located, whether it's office, home, or kind of out and about. And we've had a great mixture of people who've been engaged through this approach. It's also meant as well that we've got this sort of lasting legacy of a resource as well, and I think that almost ticks off one of our biggest things as well, which is again about making sure that people understand what what they can do about planning for better mental health, and in bite-sized chunks. So we've covered from looking at needs and assets assessments, again the different tools that have been available, such as the Joint Strategic Needs Assessment tool, return on investment, how people have used those locally. Again, also about partnerships and alignment, mentioned cross-sector working, but again, we've got some pretty interesting approaches that have already started to come through there, working with Blue Lights and others. Translating needs into deliverable commitments. Again, some really clear things coming through, actually, particularly through our first local authority area signatories, such as, Hertfordshire, Warwickshire, Middlesbrough, Redcar, the list is ever increasing really, where actually they're demonstrating how you can map need and then actually reflect that in what you do, and also as well they're sort of shining light on defining success. So working again, as Anna's already said, worked with Kaleidoscope in particular to look at ways of evaluating and how that can be used locally and nationally. And importantly, again, you'll hear from Corinne and Andy today as well, woven into their presentations, is about that sort of local and national leadership and accountability, and that's both to sort of the citizens and residents of our areas, but also again importantly making sure that people use their leadership roles responsibly to ensure that we have more of a focus on prevention and promotion.
Brilliant. Thank you, Lily. And we're now going to hear from Andy Bell. So Andy, hopefully you're still on the line and you can just take us through some of your reflections from across the Learning Events series.
Yeah, thank you. And I mean, it was a fantastic series to be a part of, and I think we learned as much as we were able to share during all of the events in different parts of the country. But in many ways, the real kind of thing that struck me was that there is an enormous amount of interest and enthusiasm in public mental health in every part of the country. Wherever we've gone, there have been people who whatever position they're in, wherever they've come from, whatever their starting point, they really want to make a difference on prevention. They see this as being a real mission. And I think that is something which has appeared relatively recently, certainly at that scale. I think before recently that was more kind of occasional you'd come across, and I think therefore that really talks again to something that we've heard many times about the importance of leadership. And I don't necessarily mean leadership as in people with important sounding job titles, but people wherever they are in the system, whether they're in local government or the NHS or the voluntary sector, whether they have a kind of elected member role or they're a member of staff somewhere or a volunteer. Leadership comes in many, many shapes and forms, and we've seen an enormous amount of it, and it clearly is important in opening up systems and creating permission to act. That seems to be incredibly important. I think the other thing that's come through is the importance of being able to work across a range of sectors. We know local government is at the centre of this. It's where public health now lives, and quite rightly. But I think, again, what you see where things are really starting to motor is local government acting as a kind of convener and supporter and coordinator of action across different sectors, bringing in a whole range of different people. So talking to the police and fire services, talking to schools, talking to businesses, really widening out that discussion about public mental health and taking it to places it probably didn't exist previously. Then I think a really difficult subject, surprisingly, is the importance of first of all, actually getting on with implementing evidence-based interventions. There's a surprising amount, when you think about it, that we know works in terms of prevention and mental health, and it's often seen as something that doesn't have the strong evidence base of say, treatment or prevention in physical health. But it absolutely does. If we look at things like parenting programs, we look at whole school approaches, we look at suicide prevention measures, we know there are things that can make a difference. And of course, we need to keep building the evidence base and keep experimenting. But it does feel like there is a real challenge for people actually being able to get resources to do the things we know work already. And I think that is a huge challenge. And of course, it links to that wider issue of local authorities having to work within an environment of scarcity, of having limited resources to do the things they want to do, and of course still having to make the case for public health being as important as the NHS, as we're seeing in current political debates. And then I think finally, my last reflection is the importance of being able to share across geographical areas, because people working in local government in public health are often working in quite kind of dispersed ways, doing really interesting things. And the importance of sharing practice and learning and networking, I think, really came across at the events, and the huge amount of energy that they generated just shows the real benefits of getting people together and creating relatively free-formed opportunities to just share with one another and spark off ideas.
Brilliant. Thank you very much, Andy. And just a reminder to the audience, if you'd like to ask Andy any questions or Corinne's talk coming up, any questions about that, please do pop your questions in the question box facility on your screens, tweet hashtag Prevention Concordat, or email hello@kaleidoscope.healthcare. But now over to you, Corinne.
Thanks, Anna. So thanks for the opportunity to share some of the learning from Yorkshire and Humber. We had our Prevention Concord Act event, I think it was February this year, and it was timed really well actually, because it followed from a session that we held with Andy's help around the mental health champions just the week before. So we had some real momentum in the region, and thanks. One of my, I guess, observations was that we were already building, as both Lily and Andy have said, we were already building on some energy, but this really helped to kickstart, I guess, the conversations around what local areas wanted to do to embrace the Prevention Concord Act. So for those of you who don't know, in this region, we have something called a community of improvement, which is essentially a regional network. So all of our 15 local authorities come together regularly to share best practice, share learning. We do benchmark work. We work in a very collaborative way to try and support local initiatives. So again, this the Prevention Concord Act work very much fitted into that ethos. So there was lots of, as I say, positive energy around that. We wanted to make sure that people felt that it was not something additional, and certainly not something that was coming down from above, heaven forbid, but that it was something that could be embraced to build on local work, local existing work. And I think that's what we got from the programme. We had a really diverse set of speakers reflecting sort of work around children and young people, employment, debt management, that kind of thing. And we also had lots of colleagues, not just from local authorities, but also from health and emergency services and other stakeholders, as well as I say, a lot of counsellors, because it came on the back of our mental health champions training. So as it said on the slide, I think that reflects the level of interest that we've got in the region. Would you mind pressing on the next slide, please? So in order to prepare for this webinar, what I've done is talk to colleagues in our community improvement, just to try and get a view from them what they think the learning has been. And obviously we've not been static since the event in February. We've come together and had ongoing conversations about the learning, and so these are observations not just from myself but also from across the region. And I think that the main things to reflect on, and this won't be anything new to you, but is I guess to illustrate that better mental health comes about learning what's already in the community, the assets that we already have in the community. It's not about something necessarily new or that you won't already be familiar with when you're working in local areas. And it's about embracing that diversity as well. It's about understanding, what works in certain, even down to ward level, and which of those things can be scaled up. Not everything can, but obviously there are some examples. And I think we heard in the last webinar from Christina and Jim about those examples in Somerset and Hertfordshire as well. So we've taken very much that approach here. Language is essential. One of the things that I've noticed is that sometimes we make things, when I say we, the royal we, I mean across the public health system, we tend to complicate things. So, a number of people have said to me, well, this Prevention Concord Act thing, what is it? But actually, when you unpick it, it's very much about what's already going on. It's that existing activity around supporting and improving mental health, looking at protective factors, for example, as well as managing the risk. So I think it's important that we don't overcomplicate it. And as I've already mentioned, and Andy hasn't paid me to say this, can I just make clear, but I think the mental health champions, and that doesn't have to just be elected members, but obviously they are key, has been enormously useful in this region. It really helped to act as a catalyst, I think, for having those conversations at a local level and regional, identifying who out there is a champion, who's interested in knowing more, and then really working with those people. So if you haven't had mental health champion in your area, I would recommend it. And as I've hopefully conveyed, a sector-led approach is something, again, in the region that we try and instill into everything that we do. So that's PHE working with all of the local authorities, our other stakeholders. As I mentioned, we work very closely with emergency service, for example, and they've been a key partner, fire and rescue, police and ambulance service, in driving this agenda as well, and obviously our colleagues in NHS. So that underpins our approach here as well. I think I've got one more slide, if you don't mind. Yeah, so these I've shamelessly nicked from conversations both at our event in Sheffield and from previous webinars from colleagues I've spoken to along the way. So apologies if I don't apportion these all correctly, but basically this is a long-term programme. As I've mentioned, it's about building on work that's already out there, but it's also about reflecting that some of these changes take time. They take time to embed. They take time to build. You know, the coalition of the willing, as we like to talk about. And I think it's important to make that clear, that we're not going to necessarily get quick wins, particularly when we're talking around outcome measures. A poke can help. Just to reference that came, I think, from Christina. We were talking about how accountability and assurance can help this process, and that a little bit of gentle nudging and or indeed poking can be really useful in the right places, in terms of, I guess, holding all of us to account about what we're doing around this agenda. And I think this is really interesting because in our region, we're now talking about what sort of process would be helpful for our directors of public health and our local authorities to build up some of that. You know, what would that programme of work look like? And I think the feedback I hear from colleagues in local authorities, that they think that will be beneficial. So it's important to hold on to that, I think. Yeah, obviously pushing open doors, finding the people who are already engaged, who want to work with us, rather than wasting too much time trying to convert those who don't. They will eventually come around. That's the main message. And I think the last comment was one that Julia Weldon, our Director of Public Health from Hull, who opened our Prevention Concord event, talked about. This is about the start of a social movement. So it's around, you know, embracing, as I've said, the assets in the community, working with people who are already engaged in promoting better mental health, and really embedding this with communities, and that you know, accounts for lots of success. Certainly that seems to be one of the success factors in this region, as I'm sure it will be elsewhere. So those are my main observations, as I said, the reflections from colleagues across Yorkshire and Humber. And in terms of the work we're taking forward now since the event, one of the main things, I guess, that's been really useful is, as I referenced, the work of the emergency services. So we already had a group that came together across the region, which represents all of our police forces, fire and rescue and ambulance, but that's developed some real momentum, because mental health is an agenda that they can all coalesce around and all have a priority to want to work more effectively to support people with mental health. So they've become key partners in the Prevention Concord Act work, as well as obviously all the local authorities and colleagues across other third sector organisations. So it feels as if, notwithstanding the fact that it's long term and requires significant amount of effort and ongoing support, it feels as if we've got some momentum, which is really important. And I think the thing for me is about how we keep that going. You know, once the webinars cease, and maybe some of the focus moves on to other agendas, how we make sure that continues to go at pace.
Brilliant. Thank you so much, Corinne. That's great insight into what's happening in Yorkshire and the Humber. And all, do remember that if you'd like to ask Corinne a question, or Andy or Lily, there's 3 ways you can join the conversation today, which should just be up on your screens now. And also just to mention, so the slides that we're using today are available to download as a handout on your screens, and all the webinars that have gone on before are available to watch back at preventionconcordat.com, so do check that out as well. The questions from the audience are coming in, so thank you very much for those who have sent them through already, and do keep them coming. But I'm going to steal Chair's prerogative and kick off with a question, if that's okay. So I was just wondering from all of our speakers, but perhaps Andy, we'll start with you. What most surprised you across the learning event series? A whole host of organisations were involved through the kind of 20 events, and I'd love to hear your thoughts on that one, please.
Gosh, what most surprised me? I mean, I suppose partly what surprised me is both the number and wide range of people that did turn up to these events, and I think particularly a wide range of people from sectors you wouldn't expect. So we had people coming from national parks, we had people coming from all sorts of emergency services, all sorts of voluntary sector agencies, and that was really encouraging, because I think that shows that this is a movement that goes beyond the kind of usual suspects, the organisations like ours that will always want to be part of this conversation, that it is going into other places. And I think that is very often down to the fact that mental health is talked about much more broadly now, more people are accepting it, but also the ongoing efforts of the charities of Public Health England, of the PHE centres, and indeed the really visionary people working in public health in local government, day after day after day, building those bridges out, and people wanting to be part of this conversation. So that was really fantastic. In a sense, the one area that was probably poorly represented was mental health services, and we had a lot of people from clinical commissioning groups, which was terrific, but very little representation from service providers in the NHS in terms of secondary care, or indeed primary care for that matter, and of course STPs. And I think there's a huge job to be done to make a bridge between kind of prevention and treatment, and not see these as being completely separate. We need to really make those connections much more apparent and much clearer, and build those bridges as well as out into other sectors.
Brilliant, thank you, Andy. And how about you, Lily, your view across the whole learning series, and what really surprised you?
So the first thing I think that was so everything that Andy said, and adding on, that actually the strength of passion and interest and really willingness to engage was there across all of the events, but that really stood out in the north and the southwest. And by north I mean sort of, you know, everything from Yorkshire and Humber, the northeast and the northwest, including sort of Cumbria, and then also that kind of far-reaching sort of southwest, going right the way over to Cornwall, and that was very visible, both in the sense of that it took for the first time the benefit of going out, you know, leaving the sort of putting a program together and actually going out and seeing who is going to use it and how they're going to use it, is actually that people were already demonstrating that they were doing a number of those things already. And what came through very clearly was that we need momentum to help them keep going the momentum, keep adding in the things that are going to be useful for people to sustain this, and to add on extra pieces. So you know, so that sense of, you know, it being mental health being everybody's business, being almost then hardwired back into the system. So in 5-10 years time, we never go back to, you know, not people not thinking about in particular prevention, but mental health as a whole.
Brilliant. Thank you, Lily. And Corinne, how about you? What surprised you from your events?
I suppose, yeah, that diversity of engagement, and in fact only just recently had a follow-up from that from National Parks, for example, who want to do some work with us, do some joint training, which is really, you know, really positive. I think I just wanted to pick up on the point that that Andy made as well around engagement with STPs. I mean, not particularly from the event, but both before and after. What we've tried to do here, and I'm sure colleagues elsewhere are trying to do the same, is work or talk directly to CCG commissioners and mental health providers around the opportunities of the Prevention Concordat. So using our clinical networks, for example, talking to our mental health program leads we have to have 3 STPs here in this region, to explain how the Prevention Concordat could be used as a vehicle for the work that they're trying to take forward, which, you know, to be fair, for the most part, it does look around secondary care reconfiguration, but nonetheless, there are opportunities to think about how the Prevention Concordat could be a framework for some of the work they want to take forward, and that's been reasonably successful. So in one of our STPs, there's just been an agreement, for example, that there'll be a secondment from the public health team into the STP, nominally on the back of using the Prevention Concordat as a sort of an opportunity to scope out work. So I think anything like that, obviously it requires ongoing kind of effort and discussion, but I think there are opportunities there. We probably haven't explored those enough yet. But I think this, again, it's certainly an open door. CCGs are really keen to engage around the prevention agenda, but it's probably requires, you know, going a bit further to make those connections and think about who the stakeholders who aren't round the table as much as the ones that are. That would be my observation there, and also thinking about where else in NHSE we can engage. I'm sure Lily and colleagues are busy with that, but it's about using this as a vehicle for other agendas they're trying to progress as well, isn't it?
Definitely. I think that's a really good point that all 3 of you made, in that the Prevention Concordat isn't working in isolation, and that there's other things going on, and there's work underway that should all kind of be brought together to work together. So that's great. So we'll pop over to the audience questions now, if that's okay. So Richard from Stoke, not Stroke, thank you for this question. He asks, more and more people are talking about the importance of good mental health, the Royals being just one. So in the panel's opinion, do you think this increased public awareness is translating into action? And if so, how? Lily, I might let you take the first stab at that one, if that's okay.
Bob from Stoke.
Bob,
actually. Sorry. So Bob knows that we actually have read his question. So I think absolutely. I think that we've seen a lot of change in the last several years, but really see the pickup of momentum. So Royals has been mentioned, but you also see some very famous or in the elite sort of sports stars sort of talking about mental health. And I particularly sort of welcomed the fact that, you know, for the first time actually we're seeing, you know, the sort of soaps, television soaps and radio soaps actually covering mental health in a different way. So they've always had those stories about, you know, perinatal mental health, or that something has happened, the sort of, you know, kind of in inverted commas. Whereas now you're sort of seeing storylines where people are talking about, well, actually, might the outcome have been different if, you know, either X person had helped or what they could have done, and people talking about, and those have been woven into the storylines and encouraging people to talk about mental health in a different way. They're using seeing different language. I can really sort of see that in that sort of less pejorative terms. So that's really practical. I think also as well the way that whether it's wherever it's happening, whether or not it's in businesses, in the voluntary sector, public sector, or others, people just being much more conscious about when they're wanting to plan some sort of mental health related intervention, whether that's things like flexible working, right the way through to actually what support people can be offered. They're looking and being more systematic about thinking about risk factors and vulnerability and protective factors. So again, just the way that people are approaching what they need to do differently has definitely changed. So again, that gives us a bit of traction to work with both, you know, individual organisations and areas, and also with the wider public.
Brilliant, thank you. And Andy, how about you in terms of across the events you often talked about the importance of linking between physical and mental health, and just whether you think kind of public awareness is helping with that?
I think public awareness is helping with a couple of things, and I'll come back to physical health in a minute because I'm not sure of the answer, but I think there's no doubt that we're seeing, and there's good data to suggest this, that people's experiences of discrimination because of poor mental health are going down across society as a whole. In fact, the only area they're not going down is in people's interactions with the health system, which I think is interesting and somewhat disturbing. I think the other thing that the greater awareness has led to is a greater sense that this is something voters are interested in, and that's both nationally and locally. So 10 years ago, it was difficult to have a conversation with politicians about mental health because the response was, well, nobody writes to me about it. People in my constituency don't care about mental health. Now they're getting a postbag. Now they're hearing about how important this is to citizens as part of our citizenship. And I think that is beginning to particularly refocus debates on mental health support and on the lives of people with mental health conditions. I suspect the gap there, and this is where the physical health thing does come in, is that we haven't translated awareness into literacy and understanding. And we're getting to a point where actually awareness is so high that it's actually causing worry. And because we talk more about mental health, but we don't give much direction for it, actually we're at risk of kind of creating conversations that we then can't help people with, and that kind of that needs to be thought about. We need to make sure we are actually building up literacy and understanding, as well as encouraging a greater focus on the things that we're talking about here today, on interventions that will tackle the determinants of mental health, and particularly action to bridge the gap between mental and physical health, and that's both for people who have poor mental health but don't get any support for their physical health, who we know die 15 to 20 years too early, but also people that have physical health problems where poor mental health is a part of that and completely ignored. And again, there we really do need to start making improvements on a significant scale.
Yeah, that's really true, Andy. And I think the points around, as well as raising awareness, you also have to have kind of the assets available on show, or people understand what resources and support is there. And Corinne, from your point of view in your local area, do you kind of find that that's a challenge, or something that you've been able to do well?
Well, both really. I mean, there are pockets of both, aren't there? Of course, there's and I guess we could point to areas where there's both positive and less positive practice. I think the point about raising awareness in terms of addressing stigma and discrimination, but then that also raising expectations, is a really important one. And I reflect again on when we had a session here in Leeds for councillors, the local elected members. What was really powerful was their experiences shared in the room. So the event was opened with the chief executive of the council talking about his personal experience of mental ill health, and then the health and wellbeing portfolio holder talked about her experiences as well. You know, that set the tone and the dynamic, which was completely different to any professionals explaining what the session might include. But then that then also enabled all the elected members to reflect on the not just their personal experience, but the stories, as you say, that constituents have brought to them, and how helpless most of them had felt in then being able to do anything constructive to help. And I think that's the point, isn't it? I guess it's great that we are moving towards it being much more normalised to have a conversation about mental health, and people feeling much more that they can discuss that. But then about where that's directed. So where are we then able to support people in terms of getting either structured help, or even just having those conversations, and where those people are directed to, and how we feel about the fact that there's much more discussion, I guess, much more narrative. And again, as Andy's mentioned, around I think we're some distance still from having any parity of esteem, and probably that's still an area that we need to do a lot more work on with our colleagues in healthcare.
Brilliant, thank you, Corinne. We have a question from Sue, so thank you, Sue, for this question. Sue asks, so why do you think mental health providers don't always put themselves forward when the potential longer term benefits to the NHS are clear? Lily, I wonder if you'd like to answer that one.
So I think there's 2 or 3 reasons for this, but I think the first one is that actually so far a lot of work with providers has really been focused on them getting much more smarter, clearer and more and understanding what they need to do, both around supporting people with their treatment plans and their recovery plans, but also about improving or reducing the rates of premature mortality. So again, that reducing the likelihood of early death of their clients. So we really wanted them to focus on that. That said, absolutely, we do want them to be involved in the Prevention Concordat. So as part of the second phase, and I think if you look at the original set of signatories, that we have got the NHS clinical commissioners in there. So one of the things that they will be doing over time as we work with them is actually building more about prevention into those commissioning contracts. But also we are starting, we've got the Association for Mental Health Providers who are signatories as well, and we're continuing to work with them on an additional piece this year, so that we are doing much more about getting them not just as signatories, but also that they're embracing more what they can do about preventing mental health problems and promoting good mental health. And that's both about for their clients, but also as employers, because actually as a whole we put them together, they are a significant employer across the country. So I hope that answers, Sue, a bit of your query and what you were thinking about there.
Brilliant, thank you, Lily. And we also have a question from Richie, so thank you, Richie, for this one, who asks, are there concerns about the future of mental health prevention awareness, given the 2022 current intention to remove national public health grants to local authorities? He worries that the local authority areas that receive less rates will be the ones that are most deprived, and particularly further the wider determinants of mental ill health. I think that's a really interesting point. Lily, do you want to say first?
So I think as well, and again, I was going to deliberately go very literally with the first bit of your question, which was about the future of mental health prevention awareness. So first of all, and I know it's easy to say that this is everybody's business, but it absolutely is. Also with the Prevention Concord Act, we often will shorthand, or I will often shorthand and talk about, every area. By that isn't a proxy for saying simply local authorities. It means local authority areas or collaborations. So everyone who is based in that area, whether that, again, already mentioned, the voluntary sector, NHS, private sector and businesses. And to demonstrate that, again, if you, and again, the slides will be available, more slides will be available after the webinar with this list on, is that when you look at some of the signatories that we've got there, and the idea there is we've particularly gone for national organisations that have a local footprint, so that they can actually help support and deliver something using their resources to make this happen. So we've got people like Network Rail who are doing work with their staff, and again also about changing the environment of some of their premises and facilities. Last week we also had Street Games who signed up, and again they're going to be doing work with all of their sports coaches, and again with Street Games they particularly work with areas that are again particularly groups with sort of higher risk factors, and again in their sort of more vulnerable groups as well. So we're starting to get into the wider determinants there as well, and again look at housing providers and others. So this is, as Corinne said earlier, it is a marathon. We are starting with getting more people on board. We're planning for keeping this going so that actually 2022 should be something there. We should put a marker around there, but it shouldn't be the point of where whatever happens with funding changes our trajectory.
Brilliant, thank you. Corinne, I just had a question going back to your talk earlier. You mentioned the importance of having community assets to kind of help with the aims of the Prevention Concordat, and I just wanted your thoughts on what the best way is to learn about those community assets. For someone else in another area, where do they start with kind of finding out what's going on?
Well, that's a good question. There are lots of places. I guess that's the obvious answer. So it may be around checking the local area's health and wellbeing strategy or their joint strategic needs assessment, if you particularly like reading those sorts of documents. Or it could be as simple as just making contact with your local counsellor and finding out how much they know about what's out there. Or engaging with mental health leads in each local area. There are lots of different mechanisms, and PHE, for example, are working at the moment with some software around mapping assets, and that's been a really useful piece of work that we're again supporting local areas with something called the SHAPE tool. But so I guess it depends on where you are in the system. For members of the public, I would suggest that the obvious place to start would be by going through the health and wellbeing strategy to see how much local areas are identifying mental health as a priority and what they're identifying in terms of those resources. And if you're a professional in the system, wherever you work in the system, it might be about engaging with your whoever's leading in the council on this agenda, or your director of public health, or indeed if you're in an organisation that provides mental health support, it could be about how you're linking in. So, for example, whether there's if there's been a sign up for the Prevention Concord Act, what sort of plan is that at the Health and Wellbeing Board? In Yorkshire and Humber, at the moment, we don't have any local areas that have yet signed up, but I'm hoping that's going to change soon. I know we've got areas that are sort of on the brink of doing that. They just want to make sure their plans are are secure and embedded. So I think it'll become easier to understand where some of these resources are, some of those assets are, as time goes on, and some of these things become a bit more, I guess, shared with in the public domain.
Brilliant, thank you. And Lily, sorry, Corinne, go on.
No, I was going to say that, I mean, and again, it's not looking at this through necessarily just a mental health lens. Not that that's not sufficient, of course, but it could be as simple as understanding what the local community groups are, where you live, and what's available sort of on the doorstep, that kind of thing, because they're all community assets as well.
Most definitely, thank you. Lily, just on that point about tools and resources, across the Learning Event series, we were lucky enough to be joined by people from the Public Health England evidence team, and just could you give us a bit more detail about the kind of tools and resources available, perhaps online?
Yes, so actually it's really easy. If you go into any popular search engine and type in Prevention Concordat, actually one of the first two is actually both times is actually points you to all the Prevention Concordat resources, and that's a whole suite which takes you through the examples include a joint strategic needs assessment tool, which again any area can use to do either a whole joint strategic needs assessment on mental health, and going from promotion and prevention right the way through to treatment, and you can take the whole piece or segments as you choose. I also think as well as a top tip for providers who may be thinking about this is that it's also useful there for you as well, thinking about where you might plan your sort of future direction. We also have on there a return on investment tool, which flags a number of areas of best investment, which actually also produce cash flow savings. So that includes things around debt, around the prevention of bullying, more interventions in early parenthood in terms of sort of early years. We are adding to that actually, not in terms of the return on investment, but in terms of the work that we have already been doing with Public Health England centres around things like ACEs and other adverse childhood experiences and other things that we know actually exacerbate individuals and communities' risk factors. So again, we'll be adding to that at that location, and then also as well have put on some of the resources we've done, which are the examples of what's gone on around the rest of the country. So Centre for Mental Health, for example, have done some mapping for us on who's doing what in terms of joint strategic needs assessments. We've also put on the resource on examples of different types of interventions that can be adopted locally and that we know are effective. What we're planning on doing, again, for those who missed out on the events or are thinking about, refreshing their memory on those, is that actually doing more with the, particularly the technical tools, so that it's easier for people to have a go, and that will be again through practical webinars, also some workshops that again are particularly focused on those who are thinking about doing that element. We're also as well thinking about, and again so to keep on with the keeping in touch with both Public Health England and both directly and through the hashtag, is thinking about actually how do we do much more about sort of networking and meaningful networking, and again we'd be very interested in your views on that as a way of continuing to develop a sort of shared learning environment that actually also delivers some action and change.
Brilliant, thank you, Lily. And we're having more questions coming through, and please do keep sending them. This is a question from Bob, who says, Andy made a really interesting point about the fact that there is a good evidence base for prevention of mental health problems. But a question for you all, perhaps a slightly controversial question, is from your experience from all the events, do some geographical areas get it more than others? Andy, what was your response to that question?
I think it's really mixed, actually. So I suppose the answer is yes. And I think it's where you've got an individual who's really championing the evidence base and really championing the issues behind the evidence base. Because sometimes you'll get a sense, first of all, that people may know the evidence, but they don't necessarily have the political oomph to make it happen. And secondly, that sometimes there is interest in a topic, but there is a tendency in mental health you don't see in other areas to not necessarily follow the evidence base. And a kind of parochialism, if you like, that we always do things in this way in our area, and what works for other people won't work here. And of course, sometimes that's right, and sometimes it's quite dangerous. So I think to answer a controversial question with a controversial answer, I think probably that is the case. And I think there is an issue about how much we're able to really ensure that things that are, for example, in NICE guidelines and very clearly indicated actually do happen. But at the same time, we allow people room to experiment and try different ways of implementing things that work in order to keep building up that evidence so that we don't get stuck. And I do think it's a tricky area, and of course it does need constant championing. We know that if you stop kind of pushing, sometimes you just stop. So it's really important that anyone who cares about this and wants to advocate for it really just kind of keeps doing that, and we'll certainly be doing that.
Thank you. And Corinne, how about you? You might perhaps be slightly biased, I guess, being based in Yorkshire and Humber, but do you think there's a difference across the kind of different geographies?
Absolutely, yeah. And even you know, within region, there's always going to be local differences, whether that be historical or as Andy's mentioned, around, I guess, the champion and the leadership that might be available at a local level to drive things. You're always going to get that disparity, and that's not unique to the mental health agenda. And I think that's probably why, or one of the reasons why, a sector-led approach is quite useful, because that attempts to utilise all the different versions of for how this agenda might be taken forward, rather than compare it from one area to another and say one's better than another, but to try and learn from the practice in each area and identify, you know, what's working effectively, what might not be working quite so effectively, and bringing people together to share that practice. That you know, in a sort of in a non-identifiable way, I guess. But it's, you know, that's not new, is it? And it's not going to go away. And I think what's important is also trying to, I guess, wherever possible, identify the benefits and as we've said, the evidence base and the cost effectiveness, and on all the other positive reasons why a focus on improving mental health is going to be beneficial to a local area, rather than identify that there might be difference in, I guess, practice or process.
And I think, Andy, you might have mentioned a bit earlier the importance of having leadership at all levels, and how that can impact kind of the rollout of the Prevention Concord Act or other areas of mental health work. And Lily, I just wondered if you had any thoughts or any good examples that you've seen kind of across the learning event series of that leadership at all levels.
So it's interesting because at the time of doing the events, you know, we hadn't actually yet entered the phase of getting local area sign-ups. But I absolutely, you know, some of the immediate standouts were, you know, Julia from Hull, you know, again, that kind of absolutely got it in terms of, you know, what's going on in terms of mental health, how you integrate that into what communities might want, and the community's history as well, you know, actually where you need to start and therefore and how that helps, you know, sort of map where you want to get to in terms of shared goals and things like that. So again, I think that was a quite, you know, interesting and sophisticated way of thinking it through. Also, again, you know, the Warwickshire, who was sort of much later on, again, they're sort of talking about the leadership there had come combination through their consultant, a consultant in public health, but they very much again had their, you know, two very confident elected members that were on board, who then actually helped drive not just the Concordat work through, but sort of wider work. And you can see the evidence in that in some of the other things they're doing around actually, you know, sort of fuel poverty and actually how the way that the local authority is working. And then my final one before I hand over is also, again, these are two that haven't yet signed up, but also, again, how they're using the tools. Salford and Wigan really stands out on actually that they grabbed the tools and really made them their own. So again, that, one person described the return on investment as almost effectively writing their business case for them, for some of this work. And again, with the joint, putting that together with the joint strategic needs assessment work, but again, that's been useful. And so again, that's flavour from actually quite a number of northern examples there. But anyway, that again, it just shows that where the energy is that, and again, that sort of pushing up. We're going to be taking the examples from those sorts of areas where they're already out there and doing it, demonstrating it, and recycling that back in to show others actually how it might be done, and how they can adapt to that themselves.
Brilliant, thank you. And Andy, how about you? When you made that point, did you have anyone particularly in mind when you're talking about the leadership at all levels, perhaps from the events or even maybe more widely?
Yeah, and I think it does come from all sorts of places. So sometimes it's a very senior person in public health and or an elected member, but we also saw examples, for example, where community psychiatric nurses had really started to just deal with issues like access to cancer screening. There were some particularly interesting examples in the southwest of improving access to dentistry that were just coming from people working in services who just realized there was a terrible gap and just wanted to make a difference. And of course, you see people with lived experience as well, creating groups and building networks that really challenge the established ways of doing things. And you see that in numerous places in the country, and kind of building co-production into these processes so that they're not things that are done by experts to people or to communities. They're actually coming from the community. And so I think there's an enormous amount of life out there, and it's actually about harnessing that and making the connections between people high up in the system and people everywhere else, so that you can just find your allies and work with those people to just get stuff done.
Thank you, Andy. And Corinne, for you, the concept of leadership at all levels, does that ring true for your area?
Definitely, and I guess the most important observation is that they're not always the people you might expect, or that they're not always the people who are in more senior roles, as Lily and Andy have just said. So I guess it's been a bit more creative. It's thinking about what motivates people to want to show leadership in this area, what makes people want to be champions, wherever they are in the system, and harnessing that.
Definitely, thank you. And I think in one of our webinars, we were joined by Mark Doherty from Cleveland Police, who was talking about the Blues on the Loose campaign, and that was very much kind of a movement that was brought forward by all levels across their police force, and that's been really impactful. Great, so I think we have time for just one more question. Time has got away from us, but if you have any last minute questions or comments, please do pop them in the question box facility, or tweet or email us. But I think the point was made earlier around the balance between this programme of work, or this area of work, is very much a long term. It's not going to happen overnight, and it's not going to be solved overnight, but just that balance between finding quick wins and keeping those long-term goals in your mind. Lily, I just wondered if you have any thoughts on that and how best to do that.
Again, I think that I absolutely would start with the examples that again that were sort of mentioned in terms of areas that are already up and doing this. So again, in the sort of role of honour areas are the Flag, Redcar, Cleveland, and Middlesbrough, and the sort of work that Edward Kuanaga's doing there, with that actually making sure that things are locked into the business that everybody is doing, and it's very community grounded as much as it is that sort of strategic, making sure that it's the decisions link to the direction that sort of those senior significant organisations and businesses are making. Similarly in Derby, where again, people have been very aware of some of the financial challenges there. And perhaps that's actually one of the lessons actually that's also come through me through the series and the events is that absolutely it's really important to have money and money to move around the system. We absolutely, clearly we would also always want more, and actually prevention should have more. So absolutely put my hand on that. But also as well, how much people can do with that thought and strategic thinking about where people can partner. And use resources in a slightly different way that can also help move things forward. But obviously, finance actually does escalate things.
Yes, definitely. And Andy, how about you? That kind of balance between long-term and short-term goals in this area.
It's really difficult, and some of the best evidenced interventions, actually, the benefits are very long-term and, in fact, lifetime. And we know that in an environment of scarcity and austerity, that can be very hard for people to invest in when there's an awful lot of things that have more immediate apparent benefits. But I think you see that something like parenting programs, for example, the main benefits may be long-term, but they also do have immediate paybacks, for example, in improved safety in schools and family harmony, and likewise supporting people to give up smoking who have mental health problems in mental health services. There are immediate physical health benefits as well as potentially giving someone an extra 7 years of life. And I think that's why we're really keen to really demonstrate that there are both immediate as well as long-term benefits to doing the right things. And hopefully through initiatives like Equally Well on physical health and the mental health challenge to build up that group of champions among elected members, we can really just keep making the case and keep demonstrating that doing the right things always pays off. And although many of the benefits may be over a lifetime and very significant, you can see immediate changes, and it does make a difference here and now.
Brilliant, thank you. And Corinne, any final thoughts from you on the kind of balance between quick wins and long-term aims?
I suppose it's about keeping an awareness about the spectrum, isn't it? That there's always going to be interventions that are very long-term, but as has already been mentioned, there's things that can be achieved more quickly, and actually that are about keeping the narrative alive. So keeping this conversation going and keeping mental health on the agenda, whatever the scenario might be. So I think that's part of the battle as well, is keeping the conversation going. Once you've got the ears of people who are in different organisations who may have access to funding, you never know, that you've already convinced them of the importance of investing, so that when those opportunities come around, it's much easier then to have those conversations. Once you've established and embedded this way of thinking. I think it was Jim McManus in the last webinar who mentioned about adopting a health in all policies approach, which seems very sensible. Again, strikes that note between accepting that there'll be short-term and longer-term opportunities around this agenda, the same as anything else in public health.
Thank you. We have just a couple of minutes left. So before we go to our kind of key reflections from the speakers, and to give them time to think of that key reflection, I will just say that this webinar is being recorded and will be available to view back on preventionconcordat.com. We'll also be sharing following this webinar, the write-up from the learning event series, which we hope you enjoy reading through, and we'd welcome your thoughts back on that. And finally, thank you to all who have joined today, and our speakers especially. But my kind of key reflection from today's webinar is very much, I think, what Lily said about this being everyone's business, and that it's not just about the Prevention Concordat, it's not just about one single organisation, it's about that kind of cross-sector and partnership working. Lily, what's your key reflection?
I think mine is about reflective learning, actually. I think that absolutely, again, both individually and professionally with across organisations, people thinking about what can they learn from others, and that might be others in their sort of peer group of organisations, or it might be their sort of others in their sort of neighbouring areas. But actually, there is always, as Jim said, something that you can shamelessly steal, and to do it with dignity and pride, but actually take on sometimes people have done the hard work for you. Take it, embrace it, adapt it.
Brilliant, thank you. And Corinne, your closing reflection.
Both from today and from the journey thus far has been identify people who want to be mental health champions, whatever interpretation that might mean, and stick to them like glue.
Brilliant, thank you. And Andy, the final word to you. What's your key reflection from today or over the event series?
I think we need to hang together. with anyone who will champion us, with anyone who will work with us. We know there is an enormous amount still to be done. We know we're at the beginning of a really exciting journey, and I suppose the kind of the hackneyed phrase here is there is no public health without public mental health. So we just need to keep going and keep feeling motivated and keep supporting one another, and let's make stuff happen.
Brilliant. That is a lovely note to end on. Thank you all for joining us today. Thank you, Lily, Corinne and Andy. It's been a pleasure, and do look out for this recording on preventionconcord.com. Thank you all, and goodbye.